we'll be clubbing 2 talks into one. So although this is a session on early esophageal cancers, my talk on neoadjuvant therapy will be coming in the next session. But what I want to talk to you about and what sir was mentioning about the SANO trial, we all read the SANO trial when it came out, and I just went through the trial quickly now when I knew that I was going to talk about this topic. So it was a very interesting trial. What all the surgeons need to know about this trial was that this was a large multicentric cluster randomized trial which took place for many years. Before the SANO trial, there was something known as the pre-SANO trial, which looked at the accuracy for detection of residual disease after completing chemoradiation therapy. Because that was a very big issue. How do you know accurately whether patients have residual disease or not after completing chemoradiation, and whether these patients need to undergo surgery if they achieve a complete response or not? So why is it called SANO? Because surgery as an alternative for esophageal cancer, whether surgery is needed or not. Surgery as needed for esophageal cancer, hence SANO trial. So what this trial did was it screened more than 1,000 patients, and all adenocarcinomas were 75%, squamous were 25%, like for any trial for any randomized trial for esophageal malignancy, and majority were distal 1/3 esophageal cancers, and some were middle 1/3, some around 20% were GE junction cancers. So what it did was it randomized patients between either active surveillance. First what it did was that it gave all patients neoadjuvant chemo-RT. So what was the neoadjuvant chemo-RT protocol? That is called as the CROSS protocol, which was established in the UK, and this is something which I'll be talking about in my talk later. Basically, it was a low dose chemoradiation, not a very high dose radiation, around 41.4 Gray, with 5 cycles of weekly chemotherapy. This was a standard neoadjuvant protocol established by the CROSS trial. This is more than 10-15 years old. After completing neoadjuvant chemoradiation, patients were assessed at 6 weeks and then 12 weeks. So at 6 weeks, they did an endoscopy, and the endoscopy they did endoscopic biopsies, and they did something known as bite-on-bite biopsies, which I think Dr. Puli can elaborate upon, that what is a bite-on-bite biopsy. So at least 4 bite-on-bite biopsies were mandated at 6 weeks. Patients who had no residual disease at 6 weeks again underwent a evaluation at 12 weeks. At 12 weeks, they did an endoscopy, they did a PET CT scan, and they also did a EUS, and they sampled any abnormal lymph nodes in the EUS. Patients who achieved complete clinical response, also known as CCR, at 6 weeks and 12 weeks, were then randomized to either active surveillance versus surgery, to see whether the patients who were on active surveillance, whether they had any inferior survival compared to those patients who underwent surgery as planned at 12 weeks. So what this trial established was that at 12 weeks, at 2 years, the survival was non-inferior in the active surveillance subgroup. So around 71% survival in the surgical group and 2 year survival of 74% in the active surveillance group. So this is something which is interesting. This is an option which can be given to patients who achieve a clinical complete response. Keep it in mind that not all patients will achieve a CCR. Only around 35% patients out of those 1,000 patients, they achieved a CCR. And then out of the patients who achieved a CCR, almost half of them had a tumor regrowth also. So that is also very important. And these patients were followed up at every 3 months for the first year, every 4 months for the second year, every 6 months in third year, and then every yearly from year 4 and 5. So patients have to be ready for such an intensive surveillance protocol in which they undergo repeat endoscopies every 3 months and then every 4 months. But those who are willing for such a intensive surveillance, this can be an option that you can give to these patients. So, like I said, the 2 year survival for the active surveillance group was statistically non-inferior compared to the standard surgery group. So just to talk about what is this endoscopic bite-on-bite biopsies, I would request Dr. Puli if you can just shed some light on this, because it's something which I did not understand really.